So the next part of the rolling is going to be for people that have some stiffness in the knees or any type of knee discomfort that's associated with foot pain or hip pain. Again, just like the calves help the foot, you want to work the muscles on the side of the joint that helps initiate the movement of that joint. So with the knees, you want to get the quads. Now the quad is a very long muscle. It kind of goes from just above the knee to right just below the hip. So the main meat of the quad is going to be right in the middle. After this video, we're going to work up into the hips, which are probably the more important of the areas to work on if you just had a choice and you were limited by time. But if you do have knee pain, I'll just briefly kind of show you the quad moving into the IT band and then the adductor type of rolling. Again, same roller, it doesn't really matter. What we do is we put it on the floor and lay down on it. I start just above my knee. And again, you can prop yourself up. You can lay down on the floor. You're just massaging the muscles. What you want to do is you want to roll a couple inches up and a little bit back. A couple inches up and a little bit back. A couple inches up and a little bit back. So as we roll the quads, we're going to put it on the floor as we did before. You start just above the knee, and you're going to roll a few inches up, and then about half that distance back. A few inches up, about half that distance back. So we're going to be walking the roller kind of up towards the hips. And again, your upper body can be propped up like this. It can be laying on the ground. It doesn't matter. Rolling is rolling. And then you want to you're going to feel probably most of the tightness up at about this level, which is just higher than halfway up the quad, and then you'll feel the kind of working back a little bit closer to the hip, and you can be done right about here. And then I roll back to the start, and then I'll turn my body a little bit, and then do the same thing. So I'm up on my forearm, I can be down low. You'll find the lower you are, the more it's going to dig in and hurt. So it's your body position that changes the leverage and the pressure of the rolling. And again, we just sort of work our way up, right to about the hip joint. And then, just to show you on the video, the IT band would be a little bit more on the side, so you'll be totally on your side. And you don't want to spend too much time rolling the IT band. The IT band is like a tendon. It's not going to relax very well. The part you could focus on would be more towards the hamstring. So that hamstring IT junction, which is more here. You can see I'm almost like on my elbow. I can be propped up like this. This is going to be a little better area. And you'll notice about maybe just over halfway, there's going to be a spot there. And most people where that IT band and hamstring sort of unite, and that's the part where you're going to get the most effectiveness for rolling. And what I'll do is I'll find that spot, and I'll just sort of rock into it a little bit. You rock into it, and you move into a different spot. You just keep finding the areas. And that's going to be a great way to get the quad and IT band and even hamstring to relax and help with knee function. Lastly, the abductors, which are the inside. There's two ways to do this. One is just this. You just kind of roll on the inside. The other is to put it on a bench or a chair, and you would straddle it, and you just kind of go back and forth on the chair.